Hello everyone, I'm Dr. Vanilla, Consultant Anesthetist at Apollo Hospital, Chennai. I welcome you to Raaonline.co.in in this Obstetric Anesthesia. Today's topic is a very interesting one. We have the topic on non-obstetric surgery in pregnant women. It's indeed happening more and more with the advance in science as we move on over decades, and we will look at how we can actually make a difference to this surgery. So, what is the incidence? What are our concerns, fetal and maternal concerns as an anesthetist? What literature evidence do we have about performing non-obstetric surgery in pregnant women? What are the guidelines? And how do we actually tailor a safe anesthetic management to these women? So, the incidence, if you look at it across the globe, there's about 0.7 to 2% of pregnant women require non-obstetric surgery for some reason or the other. The commonest obstetric reason per se is a cervical encerclage, for which they come in during pregnancy, and most of us end up doing this case some way or the other. The other important reason is infection, either appendicitis or cholecystectomy, for which they either plan as an emergency or over an interval surgery is being done. Trauma, cancer seems to be quite common because pregnancy allows a lot of hormonal changes, and therefore the cancers actually grow and present themselves for the first time during pregnancy. Cardiac can always not be avoided. Inherent cardiac problems due to the demand of pregnancy actually present symptomatically during pregnancy, and that may be the reason why they end up having some sort of a cardiac procedure in women with inherent cardiac problems. The other obstetric reason why you might have to have a surgery is for the fetal reasons. If the fetus needs to have surgery, they may have a non-obstetric surgery for this purpose, and immediate postpartum they still have the same maternal changes, and I would include them in this period as well if they end up having some sort of procedure in theatre. So the principles are essentially the same because the mother's physiology is the same. So what are our concerns? The fetal concerns are birth defect. The first thing the mother asks and the family asks is, what about the baby? The moment the mother is sick and she needs a procedure, we're going to be worried about the baby. Are the drugs going to affect? Is the surgery going to affect the baby? Are we going to lose the baby? The miscarriage rate can be as high as 5 to 10% in the first trimester, which is pretty significant. And if done in the second or the third, particularly the third, there's a pretty much high risk of preterm delivery. So the family, when they undergo this, they need to have an informed consent, because they need to understand what the